What's going on, guys? So, there's really no great way to report on this, so I'm just going to report on it and get it over with. I came across a couple of articles talking about changes in policy towards long term care facilities, nursing homes, etc. And while looking into what was going on with the changes, I found out what they had done with them. Nursing homes and other group care facilities will be required to test all residents and staff for coronavirus once a week, Pennsylvania Health Secretary Dr. Rachel Levine announced Tuesday. This effort will give us a clearer picture of the extent of outbreaks in nursing homes and a head start at stopping them, Levine said. Coronavirus deaths at long-term care facilities account for 2/3 of fatalities among Pennsylvania residents, and Levine said state and local agencies are working together to address the threat. Pennsylvania Attorney General Josh Shapiro has opened criminal investigations into several nursing homes, his office announced Tuesday. The Attorney General's office did not say how many facilities it is investigating or reveal the names or provide any other details about the specific allegations. In general, the office has jurisdiction in matters of criminal neglect. We will hold nursing facilities and caretakers criminally accountable if they fail to properly provide care to our loved ones, Attorney General Josh Shapiro said in a news release. While we salute and appreciate nursing home staff at the front lines during this pandemic, we will not tolerate those who mistreat our seniors and break the law. According to the health department, 2,611 of the 3,806 coronavirus deaths reported to date, or nearly 69%, have been among residents of nursing homes or personal care homes. In Lehigh County, 91 deaths in long care facilities accounted for nearly 3/4 of the county's 123 overall coronavirus fatalities. Northampton County has 101 long-term care facility deaths, or about 63% of its 161 coronavirus deaths. By testing every resident and every staff member in every nursing home, we will be able to pinpoint exactly who has the bug, who has been exposed, but who has no symptoms, and address positive cases to prevent further spread. Levine said starting Sunday, nursing homes will be required to report coronavirus infections, deaths, and tests through the same system hospitals are using. The Centers for Medicare and Medicaid Services announced the requirement last week. The Pennsylvania Health Department then will make information about coronavirus cases, deaths, and testing for individual nursing homes available to the public in news conferences and on its website. Levine urged Pennsylvania residents to continue to be mindful of social distancing guidelines no matter where in the reopening process their communities stand, noting that the spread of the virus to long-term care staff and other health workers puts vulnerable people at risk. We know that the bug didn't suddenly appear in a nursing home. It has to be brought in by staff, by the people who care for our residents in nursing homes, possibly someone who was asymptomatic at the time. Governor Tom Wolf said Tuesday that the state has taken multiple steps to protect long-term care facilities, which also have been hard hit in other states. Those steps include attempting to make sure employees have access to protective equipment. The concern about the virus spread in long-term care facilities is worldwide, Wolf said. We need to do more. To address the issue, Health Department is working with other state departments, including Human Services, which oversees assisted living and other group care facilities, the Department of Aging, the Pennsylvania Emergency Management Agency, and the National Guard. The state has also sent 1,700 shipments of protective equipment to facilities in short supply. The agencies have leveraged expertise and resources to help nursing home operators prevent outbreaks by educating staff on preventing transmission, screening for symptoms, and effectively using personal protective equipment. The health department has gotten approval from the federal government to give operators more flexibility to hire staff, and in facilities with severe staff shortages, the National Guard has been deployed, including at Northampton County's Gracedale Nursing Home, to provide care for residents and general support with cleaning and hygiene. The key is to stabilize these facilities when and where possible. The National Guard will also be involved in the mass testing effort. Of course they will. Asked by a reporter if she had moved her mother out of a long-term care facility, Levine said she and her sister complied with their 95-year-old mother's request to move from a personal care home to another. Asked why the state waited until now to start widespread testing in long-term care facilities, Levine reported that the state lacked the capability until last week. For the last 2.5 weeks, it has been extremely challenging to get the supplies and the swabs needed to perform this significant amount of testing, she said. we are better resourced through the federal government as well as through commercial labs. Levine said the testing would go on as long as needed, paid for by a combination of the health department and federal funds. She reiterated her position that infections in long-term care facilities must be counted among the coronavirus cases in each county. Workers in those facilities go home to their families and to the supermarkets and pharmacies where they may unknowingly spread the virus. We're all interconnected, she said. They are part of the community, and that's why they are included in a county's numbers. So I find it interesting what she says here. We know that COVID-19 didn't suddenly appear in a nursing home. And that's true. It didn't just appear in the nursing homes. It had to be brought in by the staff. Interesting. By people who care for our residents in nursing homes. Interesting. Possibly someone who was asymptomatic at the time. So it had to have been brought in by staff, is that right? No, those weren't the only ways that the bug was brought into those nursing homes. States ordered nursing homes to take residents infected with the bug. Thousands died. How it happened. Coronavirus has spread like wildfire through many nursing homes across the Northeast, and state officials are scrambling to better protect those most vulnerable. Yet the death toll has been devastating. On March 29th, as Pennsylvania, New York, and other states began ordering nursing homes to admit medically stable residents infected with the coronavirus, national trade groups warned it could unnecessarily cost more lives. The health directives put frail and older adults who reside in nursing homes at risk and would result in more people going to the hospital and more deaths, the American Healthcare Association and affiliates said at the time. A month later, it appears government officials should have heeded the dire call to pursue different pandemic emergency plans. The deadly virus has spread like wildfire through many nursing homes across the Northeast, and state officials are scrambling to better protect those most vulnerable from the bug. The death toll is devastating, according to interviews with nursing home officials, patients' families, healthcare advocates, government officials, and from an examination of state records by the USA Today Network Atlantic Group, a consortium of 37 Gannett, look into that, Gannett, owned daily newspapers across the Northeast. At least 3,043 people have died inside New York nursing homes due to COVID-19 complications, or about 17% of the state's 18,015 deaths as of Wednesday. In Pennsylvania, about 65% of coronavirus deaths were nursing home residents, and in counties in the hardest-hit southeastern part of the state, long-term care residents account for as much as 80% of county deaths. New Jersey had 3,200 residents of long-term care homes die due to complications from the virus, about 40% of the statewide total. About 58% of deaths in Delaware lived in nursing homes, and 46% of the fatalities in Maryland were at nursing homes, prompting Governor Larry Hogan to order residents and staff members at nursing homes to be tested for coronavirus. Meanwhile, advocates and residents' relatives have criticized state and federal officials, as well as some nursing homes, for failing to address the crisis as deaths mounted. To have a mandate that nursing homes accept COVID-19 patients has put many people in grave danger, said Richard Mullet, executive director of Long-Term Care Community Coalition in New York. We know facilities have a lot of infection control problems. We know that facilities have low staff. So what do you think was going to happen when the staff were further strained in caring for these patients? And it wasn't just Pennsylvania. On March 29th, Pennsylvania, New York, and other states all ordered that nursing homes be mandated to take in residents infected with COVID-19. New York mandates nursing homes take COVID-19 patients discharged from hospitals. This was on March 26th. So in between March 26th and March 29th, well, what did we know about the bug when these states were ordering nursing home and long care living facilities, ordering them to take in patients with COVID-19? They were ordering them to. They were threatening them with fines if they didn't. What did we know back then? Let's take a quick trip. We had looked at the Bloomberg article that said 99% of those who had died from the virus had comorbidities. As a matter of fact, 48.5 had 3 or more illnesses. It said the median age of death was 80.5. We knew this on March 17th. The CDC released a summary article about the infection at the long-term care facility in King County, Washington from February 27th to March 9th. Now, if you'll remember early on, that was the only source of infection up there in Washington for quite some time, and they were able to cordon that off and isolate the information very well. And what did they find? These findings demonstrate that outbreaks of COVID-19 in long-term care facilities can have a critical impact on vulnerable older adults. The findings in this report suggest that once COVID-19 has been introduced into a long-term care facility, it has the potential to result in high attack rates among residents, staff members, and visitors. In the context of rapidly escalating COVID-19 outbreaks in much of the United States, it is critical that long-term care facilities implement active measures to prevent introduction of COVID-19. Measures to consider include identifying and excluding symptomatic staff members, restricting visitation except in compassionate situations, and strengthening infection prevention and control guidance and adherence. Substantial morbidity and mortality might be averted if all long-term care facilities take steps now to prevent exposure of their residents to COVID-19. The underlying health conditions and advanced age of many of the long-term care facility residents and shared location of patients in one facility places these persons at risk for severe morbidity and death. Rapid and sustained public health interventions focusing on surveillance, infection control, and mitigation efforts are resource intensive, but are critical to curtailing COVID-19 transmission and decreasing the impact on vulnerable populations, such as residents of long-term care facilities and the community at large. As this pandemic expands, continued implementation of public health measures targeting vulnerable populations such as residents of long-term care facilities and healthcare personnel will be critical. As public health measures are continually implemented, public information needs will only grow. To provide information for patients and family as well as to communicate more broadly to all stakeholders, public officials and their community leaders need to work together to encourage everyone to understand and adhere to recommended guidelines to manage this outbreak. This study, you guys, this study was published originally on March 18th, 2020, 2 weeks before the governors of Pennsylvania and New York ordered nursing homes that they must take patients positive with COVID-19. They ordered them. The CDC right here says that the number one thing moving forward is to protect our targeted populations, the populations that are in danger. And the governors of many states, and I'm not going to make this political, but you need to go look at the states that did this. New York, Pennsylvania, New Jersey, Michigan. Why would you order long-term care facilities to take COVID-19 patients and threaten them if they don't? It makes no sense. And Michigan may have not fixed its situation with its long-term care facilities yet, but it has definitely written into its bills a protection from lawsuits for nursing homes. Written into the bills, according to the New York Times, nursing homes are hotspots in the crisis, but don't try suing them. In New York, 5,300 nursing home residents have died of COVID-19. The nursing home lobby pressed for a provision that makes it hard for their families to sue. So they ordered these places to take COVID patients. The infection rates account for 75% of the deaths in Pennsylvania. 30% of the deaths in this state, 46% of the deaths in that state. They ordered these patients into those facilities after that CDC study that was done on the long-term care facility in Washington State. Explain that to me. How could everybody on the planet Earth be watching what's going on in Washington State at this long-term care facility, and then a week later our governors are ordering that they must be exposed to patients with COVID-19? Explain that to me. On March 31st, we knew that the odds of hospitalization and death with COVID-19 rise steadily with age. There had been study after study after study done on this. I don't even have to review it. And what were our medical health professionals worried about in between the time in March 29th when they told these long-term care facilities they must take COVID patients and the time that they've walked that back? Have they been arguing about? What a hero. And so I've made several videos about how they're fudging this number here, they're fudging that number there, they're including this with these numbers and that with those numbers. You guys, it's going to turn out a majority of these deaths happened in long-term care facilities. And they ordered them in there. They need to answer for this. Somebody needs to answer for this. I knew about what was going on at the long-term care facility in Washington State, and yet Governor Wolf, a week later, is saying that long-term care facilities must receive COVID-19 patients or they will be fined. Now, 70% of the deaths in Pennsylvania are out of long-term care facilities. This is unbelievable crap to me. It's garbage. I wish I wasn't even reporting this. And the fact that it's not mainstream news all across the country is even more disgusting. And it only has to do with, well, what governors gave the crappy order? What politics do they play? I'm sad. I am sad for our country, for the state that we're in, for the fact that this isn't causing an uproar like it should. We're just going to let our elderly go quietly into the night. These guys that fought World War II for us. Just let them die in the old folks' home and don't think about them, right? And in the meantime, we'll use their numbers to pump up the numbers in general to put fear into people who are middle-aged. Y'all, this is disgusting. I'm out.